All right. So this is Lauren and Alexa. We are nurse practitioners here at NP to Go. And today we're going to do some question and answers about IVs. That is our tried and true, one of the first services that we offered here at NP to Go. And we are big believers in IV fluids. So we're going to break some myths and see what Alexa has to say about IVs. All right. For someone who's never heard of IV hydration, what exactly is it?
All right. So we have patients that come in all the time just to get rehydrated. And this could be a hangover. This could be, man, I've been working out a lot. Maybe we've played a lot of softball games, really anything. And typically, people can come in every couple weeks and get an IV started here in our office or contact our office for mobile services within our treatment area. So it would entail just getting some health information. You would fill out a pretty easy intake form just to make sure that we don't have any contraindications to IV visits. And then we could actually get an IV started. Usually people do a bag of fluids, and we can absolutely add some vitamins and minerals to help with replenishing electrolytes, with especially GI bugs or the flu or COVID. If we're really getting rid of fluids out of our body and we need to replenish those, this is a great way to do that. But it's also just good in general. If you're just feeling under the weather and you feel like something's coming on, we have a great immunity blend that has a high dose vitamin C that's fantastic for kind of keeping your immune system up, and a Myers blend as well, which is just straight vitamins and minerals to help just replenish those fluids.
I'm a big IV girl myself. And with flu season coming on, COVID, that sixth season. How does it differ from just drinking fluids the normal way orally?
So, unfortunately, people are just not the best at getting their fluids in daily. We do always recommend half of your body weight in ounces of water, but really, it's a process, and it takes a minute for that fluid to be utilized appropriately throughout the body. Drinking water continuously throughout the day is ideal, kind of, and not trying to get all your water in at once. But IVs, you're truly just getting an hour's worth of straight fluid that is not going to be thrown up, is not going to be, coming out the other way if you're sick. And typically, people that can't tolerate anything else, they can get IV. So that's the beauty of that.
Absolutely. It's a great way to bypass a sick stomach or
Yes, it
GI
is.
system, and get to feeling
And we can even
back to
throw
normal.
in Zofran, Pepsid.
Decadron for some of our sinus infection patients, if a steroid is necessary for some lung issues or whatever.
Vitamin B12 for some energy levels. But you can also even do like an immunity shot. You
Mhm.
don't even have to get a full IV to even get the benefits of the immunity blend that we have. If you're really good at drinking your fluids and you feel like, man, maybe I don't need it specifically IV, there's other IM injections that we can give you that will do the same.
Yeah, just give you a little boost of those immune vitamins. So what's actually in the IV bags and how does it work? You talked a little bit about the immunity blend and the Myers and kind of like what's the difference or what's the criteria for like how you decide?
So the immunity blend is really for someone that may be under the weather or on their way to feeling under the weather. They've been around someone that's sick and they just kind of want an extra dose of vitamin C. It also is going to have glutathione in it, and glutathione is a good liver detox. So, and glutathione is not necessarily something that I would have, patients, a cancer patient or anyone that has, any severe or long list of comorbidities, I would not give glutathione, but typically are healthy young individuals or even healthy, middle-aged individuals that can absolutely withstand some of those harsher things. By all means, get the immunity blend. It's going to help with your immune system and just kind of fighting off any potentials. The Myers blend is going to have our own mineral blend along with a B complex. And so it's going to give you just essentially your daily dose of vitamins and minerals. Myers is typically what I suggest for the vomiting and the GI distress issues
And migraine
for
too.
replenishing.
It's a good migraine
It's a good
stopper
the
as
Myers.
well.
Yes,
Yeah.
yes.
I always remember from the magnesium that's in there is amazing for volume restoration if you're losing a big volume or if you're battling one of those migraines. Okay, awesome. Do you actually absorb more nutrients through an IV rather than just taking the vitamins by mouth?
So the IV minerals and vitamins are going to be absorbed, not necessarily, it obviously depends on the dosage, but when you're getting stuff IV, you have to think it doesn't have to pass through the liver to be metabolized. Anything orally is going to usually go through the liver to be metabolized. And so you lose some of that. You don't get everything that you've just taken orally. You're only getting, fractions of the supplements that you're taking orally, and the dosages are different for that reason. So IV is just a way, especially if you're not keeping things down, or if maybe you're just really not getting the oral fluids that you need to, or the nutrition that you need to, and say your foods and such. Yes, the IV is going to be a better alternative for that for sure.
And can IV hydration really help with fatigue and jet lag and immune support?
So you have to think a lot of the times that we're fatigued. Why? Because we probably are dehydrated. Are we dealing with headaches? Are we dealing with exhaustion?
Mhm.
Absolutely. So what are we doing with an IV? We're replenishing fluids. We're giving you energy. We're actually fueling the tank again and allowing you to just feel better overall. And people will come in and do this every 2 weeks. I mean, just as support. You don't have to be sick. You don't have to be on the verge of doing something, or man, I've been out sweating for hours to get an IV. Yes, obviously in those instances this is ideal,
Mhm.
but even if you're perfectly healthy getting your fluids in a day, as long as you don't have heart or kidney issues, getting an IV of fluids is fantastic just to kind of keep your immune system up. I mean, there's a reason why the doctors always say drink your water every day, because if we're dehydrated, our body still can't do, water is utilized in every cell of your body. So if you are not hydrated, your body, your immune system cannot work appropriately.
How do you make sure that each treatment is tailored to the individual patient?
We review your medical history. There are obviously contraindications to receiving IVs, like I mentioned prior. So, any kind of heart failure, obviously is going to be very specific of what we will not usually treat patients with IV fluids, unless there's always a full story going on, and so you really got to deep dive into why our patients are needing fluids. And we have quite a few sick patients at home that are home health patients that just need a pick me up. They're very dehydrated because they're not getting their fluids in because they just can't tolerate swallowing. And so even with some heart issues, we will obviously, if they're not getting what they need, there is still room to replenish. Now, with your typical patients here in the office, we are going to still review all of your medical history, your medications, and then what's going on. Are you having any symptoms? Are you having a headache? Do you have the MFTHR gene
Mhm.
that you can tolerate non-methylated B12? I mean, there's so many things that kind of go into what we would prescribe per patient. And we're just going to listen to your story, see what you have to tell us, and then what you're looking to accomplish here. So we're going to look at all of that before we just give orders. And we will do that, like I said, mobily or in office.
And how long do the effects or benefits of these IVs last, or on average?
Typically, we usually don't have people come in any more frequent than once every 2 weeks. You can absolutely overload yourself with fluids. You can drink too much water, actually. Now, it takes a lot and very few people do it. But so you do want, it's not something that you want to get obviously daily or even weekly. But yeah, I mean, those IV fluids can, it's different for everyone. Depends on your metabolism, depends on what you're doing. If you're going right out into the heat of the summer during July, yeah, you're going to burn through that quite a bit quicker than someone in the winter that's just getting their regular IV infusion.
I love it. This
Okay.
has been IV Talk with Lauren and Alexa.
Come get your IVs.